Hi, my name is Carbonilla O, and I will be doing the oxygenation and nebulization checklist. Now, for oxygenation, the first thing that we're going to be doing is we're going to have to assess the client, the baby. We're going to be checking on their respiratory status. After checking on the respiratory status, we're going to be checking for the asymmetry and we're going to assess the lungs if there's any abnormalities, if there's any expanding. And at the same time, we're also going to be checking if we're also going to be checking on the lung sounds of the baby. And after assessing the respiratory status, the asymmetry of the chest, and also the lung sounds, what we're going to be doing is we're going to be assessing if there's any mucus secretions in the client, wherein it's needed for the aid of oxygen. If there's any mucus blocking airways that gives the client difficulty breathing. Now, what we usually do is we let the client cough, and after letting the client cough, what we do is, since I do not have a mucus suction bulb, what they do is they press on and they suck out the mucus of the client. Now, after that, what we're going to be doing is we're going to be checking on the doctor's orders. On the doctor's orders, we're going to be checking on how the baby was delivered. We're also going to be checking on the flow rate. And after that, we're also going to be checking on how long we're going to be administering the oxygen on the client. Now, after checking on the doctor's orders, we're going to start planning. When you start by planning, we're going to have to tell the parents now what we are going to be doing on the client. The purpose of this is to avoid anxiousness, or to give them the assurance that the baby is going to be okay. It's to remove anxiousness. At the same time, what we're going to be doing now is we're going to be preparing the appropriate things needed for the procedure, an oxygenation tube or whatever, an oxygenation tube. At the same time, since we are going to be working with oxygen, we're going to have to first check around the environment. The purpose of this is we know that oxygen is a combustible, so we're going to have to make sure we should avoid any possible hazards that may affect the environment. And from there, that's when we're going to start the implementation, or we're going to start the process. What we're going to first be doing is we're going to be washing our hands. After washing our hands, what we're going to be doing is we're going to be getting the cannula, the oxygen cannula that we're going to be using. And what we're going to be doing is we're going to be attaching this to the oxygen tank. And we're going to be adjusting the oxygen cannula or the oxygen tank to the desired flow rate for the client. After attaching it to the oxygen tank and adjusting it to the desired flow rate, what we're going to be doing is we're going to be following the proper instructions of the cannula on how to place the oxygen. So we're going to have to put the cannula on the baby. So after putting on the cannula properly, wherein the baby is breathing properly, what we're going to be doing is we're going to be assessing the client's breathing, and if there's any problems or further adjustments that needs to be done, we're going to have to adjust. And after adjusting after adjusting the oxygenation, what we're going to be doing is we're going to be explaining safety precautions, especially on those on the room or on watch. And after that, what we're going to be doing is we're going to be checking on the client's external ears, the nose, the mouth, if there's any dryness or skin breakdown, because oxygen actually can make skin dry up faster. So we're gonna have to assess that if there's any problem. And after that, what we're gonna be doing is we're gonna have to stay with the client unless it's okay to leave. And from there, what we're going to be doing is on the client's door, we're usually going to be putting a oxygen on use, so the healthcare team would be aware on what the client is going through. After that, what we're going to be doing is we're going to be performing proper hand hygiene. After performing proper hand hygiene, that's where we're going to start our evaluation. What we're doing is we're going to be evaluating. From evaluating, we're going to be checking for we're going to be checking on the oxygen perfusion. We're going to be checking on the ABG, or the arterial blood gas. And we're also going to be assessing the client's mental status. But since this is a baby, After that we're gonna have continuous monitoring, and we're gonna have like continuous monitoring on the client, and after that we're gonna have to check on the level of consciousness of the client, if the client may be lethargic or maybe experiencing anything else. And from there, um, we're done with oxygenation. And for the next checklist, what we are going to be doing is the nebulization checklist. Uh, first and foremost, what we're going to be doing is we're going to be checking on the doctor's orders. The purpose of this is to know what medication we are going to be giving on the client, on the baby. And after checking on the doctor's orders, what we're going to be doing is we're going to have to verify the baby with the client. The purpose for verification is this is a hospital protocols. At the same time, this is to avoid nursing malpractice or professional malpractice as well. So after verifying our client, what we're going to be doing now is we're going to be assessing the client's vital signs, which revolves around the respiratory rate, the heart rate, as well as we're going to be checking on the pulse oximeters of the baby. The purpose of this is so that we can have a baseline data for when we're going to be comparing before and after the medication. So this is how we're going to be starting the procedure. Now, when we're going to start the performance phase, the first thing that we're going to do is the proper hand hygiene technique. After washing your hands properly, the next thing that we are going to be doing is we're going to be explaining to the mother what we are going to be doing, especially the nebulization. We can also explain to the mother the possible side effects. The purpose of this is to avoid anxiety, and most especially it's to give them more knowledge on what we are going to be doing. Now, on the next procedure, what we're going to be doing is we're going to be placing the client on a seated position, preferably on a seated position, but more preferably is a semi-Fowler's position. But since this is a baby, what we're going to be doing is we can assist the baby through this position. The purpose of this is to help for lung expansion, because as seated the lungs can function properly. Now, after placing the client on a proper position, which is the upright sitting position, if this isn't a baby, what we usually do is we explain to the client on how to breathe properly. Proper breathing techniques consist of while holding the nebulizer, you're supposed to inhale deeply through your mouth, hold it in for a couple seconds, and then exhale through your mouth. Then take short breaths before having a deep inhalation. Now, after teaching the client the proper way of breathing for nebulization, what we're going to be doing is we're going to be assembling the now we're going to start the performance phase. But the first step that we're going to be doing in the performance phase is we're going to have to do proper hand hygiene. Purpose of this is to avoid any further infections and to keep the area or the procedure sterile, free from microorganisms. Now after having a proper hand hygiene, what we're going to be doing is we're going to be explaining to the mother on what we're going to be doing, the nebulization. At the same time, we're going to be explaining to her the possible side effects that the child may encounter. The purpose of this is to avoid any anxiety. At the same time, this gives the mother more knowledge on what we are doing. And after informing or after giving the mother a brief explanation on what we're going to be doing, we're going to have to, if the client is not a baby, what we usually do is we tell the client to sit on a seated position, or more preferably a semi-Fowler position. The purpose of this is to help in lung expansion, which is more easier for the lungs. But since this is a baby, what we usually do is we aid the baby by holding him or her like this. Now, after placing the client on a comfortable position, what we're going to be doing is we're going to be teaching the client on how to breathe properly while using the nebulizer. We're going to be teaching them the proper breathing technique, which is inhale deep to the mouth, hold it for hold it for a few seconds, and then exhale it again to the mouth. And before taking another deep inhalation, what you're going to be doing is you're going to have a few short breaths, short small breaths before taking another large one, and that's the proper way of breathing through a nebulizer. The purpose of that is for better medication that's placed on the nebulizer. Now, after after teaching the client the proper way of nebulization, we're going to be assembling the nebulizer equipment needed. So this is what I got. I already assembled it, and here's the nebulizer machine that I got and the nebulizer kit. So after assembling the nebulizer equipment, we're going to be using a prescribed medication. Since I do not have a medication, I got this from a solution from the clinic. It's a So what we're gonna be doing is we're gonna be administering the solution on the nebulizer as prescribed by the doctor. We're gonna be putting the medication as the prescribed medication by the doctor. After administering it, what we're gonna be doing is we don't usually use needles, but there's a certain solution needed. So let's just make a shift. So we're gonna have to put it there. So after putting on the nebulizer, what we're gonna do is we're gonna have to on the nebulizer, and we have to make sure that it works or functions properly. We're gonna have to make it misty before letting the client hold it. As you can see, it's smoky. And the moment it starts getting misty, that's when you can start putting on the medication. For usually for babies, since babies can't hold it, what we do is we assist the baby and we use the mask. And by using the mask, we use this. We adjust it to the baby's head. You can fit the baby properly. And we're gonna have to check if the client can breathe properly. We're gonna have to be checking if the patient can take. We're gonna let the client do the deep breath, the proper way of breathing through a nebulizer. And if the client has problems such as this panic, we should have to encourage the client to hold the breath every 4 to 5th breaths for at least 5 to 10 seconds. But that's only usually for people who can understand. But for babies, we'll just leave it like this. And from there, what we're gonna be doing is we're gonna have to tap the nebulization cup occasionally for the medication. To go down the cup. And from there, what we are gonna, as you can see, and from there, we're gonna be monitoring the client's heart rate, especially from the procedure. And next is we're gonna after doing this for a couple of minutes or time, as long as the doctor said, that's when we're gonna start finishing the treatment. And the moment that we are done with the treatment, what we're gonna be doing is we can remove the nebulizer from the client. And usually, if this was a normal person and if it wasn't a baby, what we usually do is we let the client cough So after letting the client cough, what we also do is for clients with who use steroids, we 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 instruct them to rinse mouth and gargle. That's for that's for clients who use steroids as a nebulizer. But what we're gonna be doing is, while during the nebulization phase, we're going to be assessing as well the client's heart rate, the respiratory rate, as well as the pulse oximeter. And we're gonna be comparing it from when we started and how it was going on. And from there, we're gonna have to let the client rest. And after that, what we're gonna be doing next is we're gonna be performing proper hand hygiene after the procedure. And next is we're gonna document what we have done, what we have administered on the client. And that's pretty much of our nebulization checklist. Thank you.